The last thing we got when it comes to the endocrine system is really its regulation. Yes, the hypothalamus master control sends inhibiting and stimulating hormones to everything out there. So yes, that further is regulated by, its movements, or its releasing is dictated by uh, different chemoreceptors of various different types. I get it. But we also have what is called paracrine secretions and autocrine secretions to further activate these cells. The names of these things are kind of all over the place. They're usually named for the cell in which they are released from or act upon. So they're kind of all over the place. But when it comes to these types of secretions, the great thing about them is generally they are very short range. Once they get out into the blood and get further away, they kind of get diluted out, and then they don't have the same effect. Autocrine, auto means self, right? So this is going to be a secretion that the cell itself releases, and then it comes back on itself. You see this with cells that are invaded by a virus or bacteria. So they'll go with program cell death here, apoptosis. You see it with macrophages, with interleukin 1. Interleukin 1 gets released, and that really starts the inflammatory pathway for the inflammatory response. And interleukin 1 is secreted by macrophages that further stimulates that macrophage, and that stimulates more macrophages to come to the fight. So autocrine secretions can do obviously a number of fantastic things there, but it acts on the same cell. The same cell that releases it is the same cell that receives it. Paracrine, these are close by cells. All right, one cell 2 doors down or next door to it will release a secretion, and that goes to the next cell next door or the tissue next door, whatever the case may be. But these are very, very, again, very close. We'll see a lot of this with the immune system. So those are always my best examples. When a cell becomes infected with a bacteria or a virus, it will give off a secretion and call other, immune cells to the party to try to fight it off. But it also gives off a paracrine secretion that tells the cell next to it, be like, hey, I'm invaded, get ready, you're next. And so that cell can now start to mount an immune response before it even gets inside of it. These things are regulated too. They're regulated by a number of different things. Cytokines, we'll talk about those when we get to the immune system a little bit. Growth factors in terms of when cells are going to divide. When the cell's divided, that tells the next one to divide next to it. So there's a lot of other regulators, and I don't expect you to know them. I mean, there's insulin-like growth factors, again, growth hormone and whatnot, that stimulates cells in the area to start growing. Nitric oxide is a great regulator of paracrine and autocrine secretions there. Again, a lot of it, as you're going to see, there is macrophage. Neutrophils are going to be helping us to regenerate, get the Schwann cells to cause regeneration for the neuron. Bradykinin is going to be important with the being released from the endothelial cells to do a multitude of different things. One of them is from dilation. Interleukin, cytokines, I just talked about that one with macrophages and lymphocytes. So prostaglandins, I mean, good Lord, there's a huge variety of those. I think the book goes into all of them. I mean, I may mention some, but I'll highlight the ones that I expect you to know, potentially know on exam, multiple choice. So on this slide, what are some regulators? Regulators, mount up, nitric oxide, interleukin, okay, and bradykinin. I mean, platelet-derived growth factor. I mean, we'll talk about that with blood clotting and whatnot. So I guess these 4 would be the dudes that I would know, potentially know. Again, maybe a multiple choice question, maybe 2. I don't really know. To that end, we will talk about prostaglandins because it is kind of the most, it's the biggest one, has the most wide-ranging effects, and it is highly varied depending upon the cell that it's going to be acting upon. This one, prostaglandin, is made from arachidonic acid, which is omega-6, the omega-6 fatty acid. It gets released, as you can kind of see there, but it uses the COX enzyme. So COX inhibitor, goes into affecting these type of secretions here. And it's part of the echinosoid family for those that take nutrition. Omega-6 is associated with very pro-inflammatory type of events. So you need omega-6s in your diet. If you don't get enough, it can cause some issues. But you do need omega-6 and omega-3 in a proper ratio. More omega-3s obviously will make it is not pro-inflammatory, prevents the inflammation that you see in omega-6s with arachidonic acid. But these will do a multitude of different things. Okay, I'm going to put omega-6 fatty acid. Omega-6 fatty acid. I mean, as you can kind of see, these can do a number of fantastic things. You see them with making leukotrienes involved with the inflammation process. Again, not a bad thing, but if your diet is predominantly riddled with omega-6s, it leads to a pro-inflammatory state when you're not inflamed. And then when you do mount an immune response and inflammation has to occur, I have to go above and beyond to get action to happen. So as you can kind of see, it does a number of different things: bronchoconstriction, limiting stuff, bacteria to get further down into the respiratory tree, vasoconstriction, capillary permeability there, it affects that. Again, it's part of the immune process. We'll look at those later. Vasodilation, antiplatelet aggregation. It helps to prevent platelets from clumping. Fantastic. That's great. Helps with smooth muscle relaxing, as you can see there with vasodilation. It also involved with smooth muscle contraction. You can see we can turn these things on and off. Same thing, turning the key in a different lock, it's a different response. So you can see how these things can have a wide ranging effect here. Probably the big one that I would really like you to know is the immune system, because it helps with promoting inflammation. That's probably a big one that I would know. Trying to think of later in the semester. Oh, circulation involving the blood clotting process. Okay, so these are two systems that I would talk about. Maybe this one as well when it comes to respiratory system. It helps with bronchoconstriction and bronchodilation. And you're seeing some of the COVID virus attack some of those receptors there in that part of the respiratory system as well. So those are the only three that I'll probably ask. Again, multiple choice type question, probably only one type of question from this. So just to kind of give you a heads up. There are different ways that we can prevent prostaglandins from being synthesized: NSAIDs, COX inhibitors, Celebrex, Vioxx. As you can kind of see there, COX-1 or COX-2 inhibitors. COX-2 inhibitors involved with inflammation. So if you have some kind of inflammatory response, the COX-2 inhibitor is usually what is given. COX-1 is for the stomach, or for the kidneys. So you can see here we can be very specific in how we target medication to a patient here. NSAIDs inhibit prostaglandin synthesis by inhibiting that COX enzyme. All right. Again, chronic abuse of NSAIDs, gastric bleeding, less clotting, kidney problems, obvious stuff. Aspirin is a common, obviously, NSAID. Ibuprofen as well. Acetaminophen is on here. It's believed to be a weak COX enzyme inhibitor as well. It may also work within the central nervous system as well to bring down some swelling and inflammation. It does not work for osteoarthritis. It does not work for rheumatoid arthritis. Again, that's why ibuprofen or aspirin would work best for those. It does not for what reason? For some reason, I just can't recall off the top of my head. There's some COX-2, or I'm sorry, there's some COX-3 inhibitors now. These are used to help with fever and pain, but not do anything necessarily for inflammation. Singulair is a 5-lipoxygenase that it's done in the lungs there to treat asthma. So there's a lot of fun, drugs that are out there if that's your bag. But what are ways that I can inhibit prostaglandin synthesis? Through NSAIDs or COX-2 inhibitors. Okay. NSAIDs inhibit prostaglandin by inhibiting the COX enzyme. Don't make it, don't get it. Obviously, gastric bleeding because it inhibits the COX inhibitor and affects that enzyme there, so you don't produce enough materials within the stomach to buffer that acidic content there. So that's why you get issues because it's affecting the enzyme, and as you can see, it's down here affecting the stomach. So gastric bleeding is going to be a common thing there for that.